Hey folks, Dr. Rob Jones here, heydrrob.com. If you're watching my previous videos, we were talking about how to correct what we call flexion intolerance, okay? We had movement-based correction, and then we had not doing all the backbreakers. Now you get on my website, heydrrob.com, check out, there's a big list there of all the backbreakers that you don't want to do, and then we've got a nice video list of the core exercises you can do. My book, Protect Your Back 101, has all this explained, so I'd love for you to check that out. And it will tell you what not to do, it will tell you what to do. It's all video based, so you have everything right there at your fingertips. So we're going to talk about one of my probably the biggest pet peeve I have in practice is the wrong type of information on how to brace your core and what the core is. So quick little explanation here because I don't want to bore you with too much anatomy. The role of the core is very simple. Okay, I want you to remember this. This is super important. Its job, okay, the core isn't your abs, it isn't your obliques, it isn't your transverse abdominis by themselves. It's all of it together, okay? So when you have a fitness instructor, or when you have a Pilates instructor, or when you have a yoga instructor, when you have a bar class instructor, when you have a fitness instructor at the gym who's been watching a celebrity DVD and they're saying, lay on your back and flatten your spine out and pull your belly button back, vacuum that belly button, they're giving you the wrong information. We know through all the other videos and all the research that you never want to flatten your spine because you want to maintain lordosis. Without lordosis, the spine breaks down, number one. Number two, if you pull your belly button back, yes, you will contract this tiny little muscle called the transverse abdominis, but it's super thin and not strong at all, okay? The core doesn't work like that. The core works by tensioning all the way around the spine, okay? So I want everybody at home to try this little trick. I want you to take your fingers, I want you to dig them into your obliques here. I want you to take your thumb, dig them into your paraspinal muscles back there, and I want you to pull your belly button back towards your spine like all those instructors have told you to do. And what you'll feel is a little tension in your fingers, but you'll feel nothing in your lower back. That's because it doesn't do anything for the lower back. It's wrong information. What I want you to do now is keep your hands here, and I want you to cough vigorously. And if you could see that in the video, my core expanded around. Now, when you cough and hold that position, tap yourself now, okay? You will have tension all the way around, and when you cough and or tension back here, you'll see these muscles expand out. What that is doing is two things. Number one, it is locking the spine into place so it won't move and break down. Number two, if you were wondering why there was a balloon in amongst my weights, this is why. When you have that abdominal brace, you create almost a bubble of pressure in front of the spine. So what's going to happen, let's actually do this here. What's going to happen is this. Your spine is going to be nice and protected because you have tension from the musculature here, tension from the musculature here, and that volume of pressure you're creating by that intra-abdominal pressure here is pushing up against the spine. Now your spine has a wall of air to push against, so it's nice and stable. If you keep that, and I'm going to teach you in a minute here how to breathe with that while you're doing the proper exercises, not the backbreakers, even if you have a painful back, these exercises shouldn't hurt. If you do this mechanism right, your pain will go away. If you do these mechanisms wrong, the pain will come back, so you just have to learn how to reset. So again, it's don't belly button, vacuum, brace, lock it all in, get that intra-abdominal pressure going, and you're going to feel a ton better. Okay, so let's practice doing this, shall we? Okay, number one, let's get that balloon out of here. Number one, we're going to practice that good brace. Now, here's the trick to this. When you brace, you're going to feel like you're going to have to hold your breath, okay? A lot of people will brace and then they'll get red in the face and go, what do I do now, Dr. Rob? I can't breathe. You have to learn how to breathe with this bracing mechanism. And what that is like is this. You have to picture your core as a cylinder and your diaphragm moving up and down, kind of like an accordion inside a glass tube. If you've watched television, you've seen operating room shows where there's surgery going on and you'll see a ventilator. It's that plastic tube or glass tube and it has an accordion. That's the breathing mechanism for the patient. That's really what our core is doing, okay? Our core is the cylinder and our diaphragm, which is creating movement so we can pull air into the lungs, push air out of the lungs so we can breathe. We have to learn that mechanism. So we're going to brace and we're going to hold that brace. And what I want you to do is I want you to dig your fingers in. And as your fingers are dug in, I want you to breathe inward as you push out against your fingers. Now here comes the hard part. I want you to push outward against your fingers as you breathe out. That tends to be the challenging part because naturally we breathe in and we expand, but when we breathe out to push the air out, we drop in, and that's where you're going to run into problems. So let's practice this. We're going to brace, stick our fingers in here, should be nice and solid, all the way down to your pubic bone, which is this bone here. You should be able to poke all the way up through here and around, and it's hard. Now breathe in, breathe out, and there should not be any movement through your fingers. If you're doing this wrong, you're going to see this. Okay, we don't want that. Okay, so that's your bracing mechanism. That's your what we call intra-abdominal pressure. Practice that, and if you can get good at that while you're doing core exercise, research shows you should have about 15% of abdominal brace on at all times. So even when you're walking, think about a little bit of a brace. You don't have to, okay, I'm walking around, Dr. Rao, this is good. I'm gonna stay stable. That's obviously not very effective. So just brace about 15% while you're walking around. While you're on the ground, like we're gonna do in our next videos here, we're working on exercises specifically, we're gonna brace, okay? In the meantime, think about brace and breathe. So brace, diaphragm goes down, diaphragm goes up without this moving. So that's your intra-abdominal pressure mechanism. That's your bracing mechanism. Don't pull the belly button back. Keep this braced, stay in lordosis, and you're going to protect your back.